Hi, it's a few days before my surgery. I'm having a septoplasty and a terminate reduction. Just give you a quick picture of what they're doing. This is CAT scan from about 2 years ago, where it shows deviated septum here, and these are concha bullosa. So those are air cells in the terminates. So just on the side of your nose there. And I also have Haller cells. So those are little air cells on your orbital ring. I'm hoping they do something with those, but I'm not sure they're going to be able to do that with this surgery. But the goal of the surgery is to clear my sinuses so I can breathe easier through my nose. Currently, I have sleep apnea and I get headaches every day. So the doctor said that I have a 50 to 80% chance of reducing those headaches with this surgery. So I'm very excited about that. I'm going to give you a quick profile of what my nose looks like right now. There really shouldn't be any changes on the outside. They're mostly going to be straightening right in between my eyes where the deviation is. But the surgery should be, I guess she said about an hour that she's performing the surgery. It's done under general anesthesia and it's an outpatient procedure. I'm really looking forward to it. I had a septoplasty and terminate reduction just a few hours ago. They put this gauze under my nose just to catch the bleeding, but there's actually nothing in my nose. This is kind of where I got the IV and where they put the medication. My throat is a little bit sore, but not bad at all. There might be a little bit of pressure in here, but again, not bad. I don't feel the pressure in between my eyes that I used to always have. Like that headache is just gone already. The procedure took about a half hour, according to the doctor. I was at the surgical center for a few hours, just waiting for the most part. That was the longest part. And then they had you get ready and you talk to the anesthesiologist, the nurses, and the doctor. So you talk to several people there, and then they take you into the procedure. They run the medication into your IV, and that kind of burned a little bit, but it put you out pretty fast. And then I woke up in recovery and left shortly after. Within a few minutes, I got dressed and was out the door. So very quick. So far, everything's going well. The surgery was probably got out just about 2 hours ago. So I'm already feeling pretty good. They said I should just sit up for a while to make sure everything drains right. They gave me some prednisone for a prescription and an antibiotic. They also put an antibiotic in the IV line too. So they give you that at the time of the procedure. And other than that, I feel good. Surprisingly better than I thought I would and more coherent than I thought I would be at this point. There hasn't been that much bleeding. I haven't had to change the gauze since the recovery room. And yeah, it was easy. And I mean, I'm already breathing better, so I feel like that's worth it. And just the pain right here that was always there, it's just gone. So yeah, definitely worth it so far. It's a day after surgery and recovery is going really well. My throat no longer hurts. My nose isn't really bleeding much. It doesn't hurt. There's a little bit of pressure right here and I'm still feeling pretty congested, but other than that, you know, everything else is good. I'm on prednisone and an antibiotic. I didn't really sleep that well last night, so I was really tired this morning. But after that, I feel like I could have gone to work and been okay. The nose is just bleeding a little bit here and there, but I don't need anything underneath it. Here's a little preview of what it looks like. It still feels like it's a little bit inflamed and swollen, so maybe it'll go down a little bit soon. But I'm really happy with the results so far. I don't have any headache right here, which I used to have a headache all the time right here. And then I would have pressure like around my eyes, just right in here. And I don't really feel that. So that's amazing. Just right here, it just feels swollen. and hopefully that'll go away in a couple days. So definitely worth it. Yeah, so I feel like it's just going to get better from here on out. It's been about a month since I had a septoplasty and permanent reduction. I had my post-op appointment. After a week after the surgery, they took the splint out of my nose. They used an endoscope and kind of went up there with a vacuum and it was about 1 inch to 1/4 inch wide splint out of my nose, and they just cleaned it up a little bit so you can breathe even better after your appointment. I didn't even realize that was up there because no one had told me. And so that was even more of a relief, and it's kind of a surprise when she took it out, but a good one. Recovery kind of takes longer than expected after you're off the medication. So right after the surgery, they put you on a steroid, prednisone, and after I was off of that, I got more headaches. So just be aware of that. If you're prone to headaches, you might get more headaches before you start to get less. And I read that online. I confirmed that through a few different sources. And also weird smells are normal, which I've experienced. It just kind of smells almost like a sour milk. And sometimes you'll get a little bit of discharge out and it smells better, or it just smells different. So it's just kind of an interesting process of recovery and clearing things out, and just getting used to breathing again, because I'm used to breathing through my mouth. So I have to catch myself whenever I'm breathing through my mouth and try to make myself breathe through my nose, because I can do that a lot easier now. So getting used to that is also a process. I've been sleeping sometimes without my CPAP, sometimes with it. I actually had the CPAP shut off one time. I'm breathing through my nose. So I probably need to just switch from the full mask to a nasal pillow, which I haven't bought yet, but I will, because it seems like that makes a lot more sense. But just wanted to make you aware that recovery can take longer. I have another post-op appointment at 3 months where your full results, your full recovery should have been taking place. At this point, you're just kind of getting used to it, and you might have some weird symptoms, some extra discharge, maybe some headaches that you should be aware of, and also watch out for infection. So if you're having a really severe headache or a lot of discharge, or you see swelling or your nose is red, also let your doctor know, because that's not normal. If you're concerned about weird smells, maybe you want to check in with your doctor, make sure that's okay, because it's a quick check. But there's a lot of kind of weird symptoms after your surgery. I'll just give you a little view of the results so far. I do feel like my nose is a little bit smaller. The tip of my nose kind of points down a little bit more. This part feels smaller. My CPAP machine, since it is a full mask, it does fit better here. I don't have problems with it rubbing here anymore. And here's the other profile. And I just feel like it's not as swollen here. It just feels in general smaller, and I can definitely breathe a lot easier, which is great. But definitely worth it. So if you have this scheduled, good for you. You're gonna love the results. It's definitely a worthwhile surgery. Recovery is pretty easy, but it can take longer than expected. So that's just something I want everyone to be aware of, that having discharge even a month after surgery is normal. Like I've been getting, I don't want to go into too many details, but it's not normal discharge for me or really anyone. You might get some weird colors and some surprises, so let's just put it that way. But again, it's still worth it. So good luck, and thank you for watching.